New treatments for cancer weren't the only topics of conversation at the world's largest cancer research conference this week, which we reported on yesterday. Researchers were also focused on new, less invasive ways of testing for that disease. Meg Tirrell reports.
Enter the liquid biopsy, or a blood test for cancer. A featured study at the conference showed one such test yielded similar results to more invasive tissue biopsies.
The concept of a liquid biopsy is if you can get all of that same information through a simple blood draw, you could totally change the paradigm of how we monitor, detect, and treat cancer.
Helmy El-Touki is CEO of Guardant Health, the maker of that test. It works by detecting bits of DNA shed by cancer cells that circulate in the blood.
Cancer cells, as they grow rapidly, they start dying rapidly, and they shed their unique DNA into the bloodstream. So you take a tube of blood from a cancer patient, there'll be small traces of DNA in that tube of blood that are coming from the cancer cells.
Guardant is one of many companies working to develop new blood tests for cancer, a market Cowen estimates could eventually reach $10 billion. But doctors caution it's early days.
There's a lot of hope and some hype in precision medicine.
The hope is that one day blood tests could be used to diagnose cancer, replacing traditional tissue biopsies, which are more invasive and can be more expensive. But Dr. Michael Thompson of the Aurora Cancer Center in Milwaukee says right now, tissue biopsies are still the gold standard. But blood tests for cancer have their place in helping monitor patients after diagnosis and guiding treatment decisions. And Foundation Medicine, another competitor in the space, says 10 to 20% of cancer patients are ineligible for traditional biopsies.
Instead of just letting those patients go and saying there's no ability to understand your tumor, we now have the ability in certain cases to use a blood-based test to assess it. So it's just another piece in the puzzle. It's another tool in the toolbox to help us understand a patient's cancer.
Work in the area is accelerating. Earlier this year, genetic sequencing giant Illumina announced it had formed a new company to develop a blood test that could potentially diagnose cancer earlier, potentially replacing the traditional biopsy. But experts say it is still years away. Illumina named the company Grail. For Nightly Business Report, I'm Meg Tirrell in Chicago.